Good morning. This is Dr. Velasco again. How are you? So this morning we're going to talk about implant failures. We've been getting a lot of questions on our website about implant failures, and I want to clear some things. Basically, there's two major categories of implant failures. There's early implant failure and there's late or delayed implant failure. Early implant failure means that the implant or the fixture fails or is lost, has to be taken out early on, immediately after surgery or in the weeks right past the surgery time. We count around between 6 to 12 weeks still early. So if the implant is lost in that initial stages of healing, it is called early. And then delayed is when it's lost after that. Once the implant has healed and the bone has grown around it and has what we call osseointegrated, then if that implant fails later on, then that's delayed. So let's talk about early implant failures first. Early on, implants fail because one of three major reasons. Reason number one is infection. Reason number two is surgical placement or poor surgical placement. And reason number three is poor prosthetic load or destructive prosthetic load. Let's talk about reason number one, infection. When there is an underlying infection or there's an infection in the site, there was a tooth there, it was infected, and we pull the tooth. If that infection is not cleared completely, is not cleaned completely, and is not taken away or is not let heal completely, and we place the implant into that socket, that infection, there's a very high probability that will attack the implant and the surface of the implant and will not allow the bone to grow around the implant. So that's pretty simple, pretty self-explanatory, and we just have to take good care of the infection, get rid of it, and then we can place the implant. Reason number two, poor surgical placement. This goes with amount of bone and type of bone. Is there enough bone, a lot of it, or very little? And is the bone strong or the bone is weak? If the amount of bone is very little, normally what we do is we do a bone graft before, let that heal, and once we have enough amount, we place the implant and it is a success. If the type of bone is not very good, what we do normally is place the implant and let it heal unloaded, untouched for a longer period of time, because that implant inside the bone that is not as hard will start challenging the bone, and the bone will start getting a little harder and a little bit more dense around the area. So there is ways to bypass all of these problems. The third reason why we lose an implant early on is prosthetic. Prosthetic meaning we put a tooth or a set of teeth over the implant or implants, and one of them is loaded poorly, and the forces of when we chew and when we bite and when we grind our teeth and whatever are too strong over one implant, and that implant starts moving a little bit during healing, and it's not allowed to properly integrate to the bone around it, and that causes that implant to fail. So if we are careful from the get-go and we make sure that we eliminate or we have no infection, and if we plan properly with a CT scan and we know how much bone and how good the bone is, and if we plan properly in how are we going to do the teeth that are going to go over the implants, there is success. And we can be successful 98.5% of the times if we plan properly. Everything about implants and everything about dentistry, by the way, is proper planning. If we plan properly, we can deliver properly. If we deliver properly, we can get the right results and we can get happy patients. That's it for early implant failure. Thank you for listening. I will be talking about delayed implant failure in our next video. Thank you and have a great day.